what is a gap?
Yeah.
So when the teeth are placed onto the healing gums, okay? Over the course of that healing period, we talked about that 4 to 6 month, the gums and the tissue will pull back a touch from the prosthetic. About 95% of the time, we find that the amount of gap or space formed between the gum and the prosthetic is our perfect hygienic space, okay? We want you to be able to clean underneath that prosthetic because your toothbrush only reaches certain points. Your water pick certainly gets out big chunks, but like flossing and other home care is going to reach where the brush doesn't reach and help you keep clean. Think about this. If you have a large couch in your house and it is pushed up against the wall, and then 2 years later you're moving, what do you think you're gonna find behind that couch?
I don't even want to know. Yeah.
When there's no gap or ability to clean, you're gonna find a lot of interesting things down there that you really can't reach. Now, separate that a bit. You can vacuum in through there. You can sweep. You can do whatever you'd like. So it's that same kind of concept. And if you're getting a prosthetic that has absolutely no gap and is crushed up against the gums, it's not a perfect blend, right? You have your gum tissue and you have the prosthetic. So there's always gonna be a micro gap, but now you can't reach it to clean it. So about 1 millimeter, or like the thickness of 3 eyelashes, like stacked on top of each other, is what we want so you can actually clean underneath it.
But you didn't answer my question. Does the gap only happen with Nuvia's permanent teeth in 24 hours, or can patients who get dental implants through a traditional method also experience a gap?
Thank you for following up on that one.
I'm not letting you off the hot seat, girl.
So everyone's body is going to heal, regardless of whether you're putting our prosthetic or a different one. The gap comes from the tissue pulling back from the initial prosthetic that's put on there. So whether that's a temporary prosthetic or a final prosthetic, your body's gonna heal, hopefully, right? So you will experience some sort of gapping regardless of what you have in.
Okay, okay. And if a gap does form, I know you mentioned by design you like to leave a little bit of a gap for cleaning, but what if a patient feels like it's too big or there's too much of a gap? Does Nuvia address that at any point?
Yes, it's a normal part of healing. Right when you get out of surgery, your tissue is going to be a little bit swollen. And that's what the initial prosthetics are made out of, whether they're the permanent teeth or the temporary teeth. So as your body heals, that swelling is going to go down. And that's where that little gap comes from.
How much do dental implants cost? Download the free cost guide in the description below to find out.